Okay. Well, thank you very much for coming. Before I start, I'd like to know a little bit more about you. And so I wonder if we could do a little bit of a sort of an introduction session. Could you do this? Could you talk to the person who's next to you? And if you're on your own, move over and find someone to be next to you. And then find out a few things about them, and in particular, why they decided to come to this seminar. Well, thank you everybody for those introductions. I know a little bit more about you now. So this is Wales. It's a small country next to England, and this is where I grew up. I grew up on a little island, and these are the mountains, and this is the sea, and it's really beautiful. And if you get a chance, you must go there. I think it's paradise. The really nice thing is, at the time that I went to university, the government paid for children to go to university. So nearly all of my education has been paid for by the public. And so I'm really lucky, aren't I? I'm really, really lucky. So given that nearly all of my education has been paid for by the public, I've got a responsibility to the public. That's the way I see it. And so what is my responsibility? Now, I became a doctor and then I became a researcher. I believe my obligation to the public is to tell the truth. I think that's the most important thing that the public would expect from researchers. You see, researchers are really lucky. Now, there's a book I read when I was a kid. America had invaded Vietnam, and when I was a child, I used to watch the TV, and there was all these bombs falling on Vietnam all the time, and I used to wonder what the heck's going on? You know, why is this happening? And it was very difficult to tell from watching the news or reading the papers. According to the news, somehow Vietnam was invading America. I couldn't figure it out, but it seemed to be that it looked like American bombers were dropping bombs on Vietnam, and I thought, well, what's going on here? And it was very difficult to find out. And then I read a book by Noam Chomsky, and I really liked it. I read things by Noam Chomsky, and he seemed to tell the story very clearly. And I got interested in the sorts of things that he wrote, and he wrote something that really made sense to me. He said, the responsibility of intellectuals is anybody, I think, who's had a good education. The responsibility of people who've had a good education is to tell the truth and to expose lies. Yeah? So you have had a good education. It doesn't matter if the public paid for it or not. In a way, the public always pays somehow. But you've had a good education, and so your responsibility too is to tell the truth and expose lies, I believe. It's our main job. And if you know that, it becomes very easy when you describe yourself. You know, what do you do? I'm a whatever you are, and my job is to tell the truth and expose lies. And that sums up, I think, the main responsibility of a researcher. And it's because, it's another paragraph, Chomsky writes, for a privileged minority, and we're all privileged, Western democracy or Eastern democracy or whatever, provides the leisure, the facilities, and the training to seek the truth lying hidden behind the veil of distortion and misrepresentation. So we're given this luxury, this real luxury of having time and resources like the libraries and the papers and the computers and everything to actually try and find the truth. Yeah. So we've got I think that it's the reason research integrity matters. It's part of our job description. You know, it's the most important part of our job description. And it's a funny thing, really, because it's so important, but nobody ever teaches you about it. I don't know if you've noticed that. There are certain things that people can't talk about. It used to be sex, but now people can talk about sex. They find death difficult to talk about. But in universities, we can talk about sex and death, but we can't talk about research integrity. Research integrity seems to be the thing that nobody can talk about. So I work in a London School of Hygiene and Tropical Medicine. I don't think we get students from all over the world. We teach them epidemiology, statistics, infectious diseases, everything, but we don't teach them research integrity. And it struck me how strange is that actually we're a school of public health and we don't teach research integrity. We don't even talk about it, actually. I thought that was strange, and so I putting this sort of course together was something that interested me, although it is getting noticed as an issue by the public. The public thinks research integrity is very important. People in universities don't think so because they don't seem to talk about it at all. But the public thinks it's important, and we've got in the UK, we've got a sort of government inquiry into research integrity in the UK, and I think that's a really good thing. Now, I was trying to find out about what research integrity means, how you say that in Japanese, and it's kosei. Kenkyu kosei. Why are you laughing? My Japanese is so bad. Kenkyu kosei. Integrity is a funny. Integrity in the English word. It has a sort of two senses. It has something that's integral is kind of whole. So it's the kind of opposite of being divided up into pieces. When you're whole, that's a sense of integrity, but it also has the meaning of being honest and having strong moral principles. And there's a kind of, in a kind of Zen way, there's a bit of a link between those two, I think. You get a feel of, if you're dishonest, you're not kind of whole, you're all pulled in different in directions. So there are a number of definitions of research integrity, and they're a bit difficult. Possessing and adhering to high moral principles and professional standards. So the difficulty of this is that there's high moral principles and professional standards. So you've got this problem. You've got this. You can divide responsible conduct of research into two kind of areas, really. There's research ethics, and that's what those are kind of moral discussions about what you should do. Is it right to, moral questions about right and wrong. And then there's research integrity. I think research integrity is more a sense of, are you adhering to the appropriate professional standards in your work? And I just want to focus on this one to some extent. I think moral principles, you can have all sorts of moral discussions where it's, is it right to, help somebody end their life, and all of these questions of moral principles. But research integrity is a little bit more straightforward. It's about what's appropriate, what's appropriate given your professional standards. And whereas this one kind of research ethics leads to a lot of questions, research integrity really should lead to a lot of clear guidelines about how you should behave as a researcher. And so we've got this sort of, on the one hand, we've got responsible conduct of research. This is the good news. And it's conducting research in ways that fulfill the professional responsibilities as researchers, as defined by their professional organizations, and so forth. And at the other end, we've got research misconduct. Yeah? So we've got responsible conduct of research. That means conducting research according to the kind of guidelines, what would be expected by the public or the institution that you work for on this side. And on this side, you've got research misconduct. Yeah? And research misconduct, in the United States, they talk about FFP. So FFP, and it's fabrication, falsification, and plagiarism. Yeah? So fabrication is making up data. Yeah? So when you don't collect data from patients, you just actually make it up. I think in Japanese it's netsuzo. Is that right? So fabrication is netsuzo. Falsification is different. Falsification is where there is data, but you change it. Yeah? I can't remember what that is. Is it giso? Anybody? Kaizan. Okay. So we've got netsuzo, kaisan, and plagiarism is when you take other people's work and you pretend it's your own, and you don't acknowledge the fact it's somebody else's work. And I think that's toyo. Is that right? So we've got netsuzo, kaiso. Is that right? Kai, what did you tell me? Kai. Zan or Dan? Zan. Netsuzo, Kaidan, and Kaizan, sorry, and Toyo. There we are. See, you've all been educated in Japanese very badly. So there's a US Office of Research Integrity, and these are the things it's mainly interested in. Yeah. So you've got responsible conduct of research on one end, you've got fabrication, falsification, and plagiarism at the other end. Yeah? And this is good behavior, this is bad behavior. And in the middle we've got this. It's QRP, and that stands for questionable research practices. Yeah? So questionable research practices. So this is responsible conduct of research. This is what we want everybody to do. We don't want fabrication, falsification, and plagiarism. And then we've got this grey area in between. And tomorrow we're going to talk about this grey area in between. And the sorts of things that are in the grey area are things that we shouldn't really do, but actually are done quite commonly. So this one, selective reporting based on p-values. For some people, that's just normal epidemiology. That's just routine epidemiology. Let's look at a lot of associations. Wow, that's interesting. Let's publish that one. Yeah? So that one is so common, I think you'd have to say it's almost so common, it's normal practice. Selective reporting of outcome measures, that's very similar. That's like saying, well, there's no significant results of that, so we won't bother publishing that result, or we won't put it in the abstract. Negative results or studies not published, it could be the whole study not published. So sometimes, you get one of the negative results, but you publish the overall results and you just leave that particular result out. Sometimes you actually think, well, the whole thing I'm not going to publish. Nothing going on there. Negative, you know. Sometimes you do lots of subgroup analyses, trying to find something that's interesting. You know, people with, you know, although this treatment's not effective, it seems to be effective in people with one leg and red hair. You know, you get that sort of thing. So inappropriate subgroup analysis, data-dependent stopping or continuing. You know, we look at the results, think, wow, that's a great result, let's stop. You know, let's stop now. Excluding data after looking at the impact of doing so, and claiming to have predicted an unexpected finding. As expected, you know, there was a highly significant. These are known as questionable research practices, but they're actually very common, and tomorrow we'll look at whether they're important or not. Now, there are some important misconceptions. Misconceptions are things that you think are true that are not. One of them is misconduct is rare. Serious misconduct, fabrication, falsification, plagiarism is rare. I'm not sure if that's true. The other one is that questionable research practices are common, they are common, and they're not serious. I think that could be wrong as well. I think they're common and serious. We're going to talk about those tomorrow. And then the final thing is scientists can regulate themselves. You know, that actually we don't need rules, we don't need to be checked because we are moral, upright people and we only ever do the right thing. Yeah, I don't believe that. I don't think it applies to me, I don't think it applies to anybody.